Well, welcome to the Community Engagement course. My name is Professor Bob Burke, and with me is Professor Connie of Ashwick. Connie?
We are going to be your guides through this course. Just a bit about my background. I worked in healthcare delivery systems and public health in a number of different positions in the academic and private sectors. And throughout all of my career, I've been involved in working with the community. So as we go through this course, I'll be sharing with you my experiences from firsthand and hoping that you too will have firsthand experiences to really learn the skills as well as the content of our course.
Thanks, Connie. And again, my name is Bob Burke, and I'm a professor of healthcare administration at the George Washington University. And my areas of expertise are in management, in long-term care finance, in community development, as well as in the whole aging program. But Connie and I have actually worked together on and off on different projects for over 20 years. So we really bring together a sense of collegiality to this program and an opportunity for you to learn and to with us as we go forward on this new course. It is a new course. The course has never been taught before in this manner. You will learn, when you read and look at the syllabus, there is no textbook. There are certain articles and there are presentations that we will be providing you and lots of websites for you to find all the information that you're going to need. But the most important thing for me is for you to realize that this module requires you to be very active. It's not just a sit-back type of module at all. You are now part of the healthcare environment, and because you are part of the healthcare environment, we're going to be presenting new skills and new opportunities about the whole aspect of community engagement. These skills that you'll be learning over the next 10 weeks, I assure you, you'll be able to translate and use on your current jobs, as well as in jobs in the future. So you need to prepare yourself for this course, and you have to also understand that all the aspects and assignments we ask you to do will actually become part of what we call your e-portfolio. You'll have these items to be able to take with you. We, on the other hand, want you to understand is that we're not your teachers in the formal sense. We are your guides and your co-learners. And in fact, our mantra for this course is, let's learn it together. So we're really excited to be here. What I really want Connie to do now is to explain what the whole vision we have for the next 10 weeks. So Connie, could you walk us through the course?
Okay, thank you. So the purpose of this course is to convey why it's essential for health organizations to be engaged with their communities and to give you the skills as managers and leaders in your organizations to help your organizations do so. You all have the syllabus. We're not going to go through it in detail, but I will highlight that there are detailed learning objectives, and for each learning objective, there is a related competency, a skill. So we want you to have the knowledge, but we also want you to be able to do and apply. So there are 15 competencies. They relate to the 5 competency areas that are in the GW framework. So we're very comprehensive in what we hope that you will be able to accomplish. You can go through the learning objectives and all in detail. In addition to this, we have some excellent guest speakers. We have national experts from leading organizations who've been leading the charge for hospitals and healthcare to be involved in community. So we are honored that they will join us, and I think you will be pleased when you see the excitement that they bring to this course. In terms of what we hope that you will be able to do, we have 3 group projects that you will be able to add to your e-portfolio, and we have 10 individual assignments. So each week we have a list of 10 topics. We'll cover a different topic each week. There'll be an activity for you to do so that you're confident that you do have these skills, and then we'll compile them and synthesize them into group projects. And with that, I think we're ready to learn together.
Great. Thanks, Connie.